So let's talk about vitamins after your gastric sleeve.
3, 2, 1.
Here we go!
After gastric sleeve, also known as sleeve gastrectomy, it is crucial to take certain vitamins and supplements to prevent nutritional deficiencies, as the surgery reduces the size of the stomach and can affect the absorption and nutrients. Specific recommendations, of course, may vary depending on the individual needs, the extent of the surgery, which depends on your surgeon's technique and the patient's pre-existing nutritional status. However, here are some general guidelines that I know you'll find of great value. Please note that I will try to avoid mentioning the amount of international units or milligrams you need for each and every vitamin. Otherwise, this would be a very, very long and technical video. I will also try to avoid discussing or promoting brands to avoid confusion or even a biased opinion. Okay, let us begin. You need to take a multivitamin. This is your pillar. This is the most important priority while supplementing after a gastric sleeve. A multivitamin is a preparation intended to serve as a dietary supplement with several, of course, vitamins, dietary minerals, and other nutritional elements. The contents of a multivitamin, of course, can vary widely among products, but most contain a range of essential vitamins and minerals that are important for your health. A multivitamin is recommended to ensure a broad range of essential nutrients are consumed. And again, this is the most important supplement you should be taking after your weight loss surgery. Now let's talk about vitamin D. This is crucial for bone health and immune functions. The body's ability to absorb vitamin D can be impaired after bariatric surgery, so supplementation is typically advised. Check your multivitamin, since most of them already have vitamin D, and it is recommended you consume between or approximately 3,000 international units or 75 milligrams. If your multivitamin does not provide you with this amount or similar amount, which I am assuming it doesn't, then I would suggest you take vitamin D additionally. That is why I am mentioning vitamin D separately. You need to take calcium. This helps prevent osteoporosis and other bone-related issues. Now, there are two types of calcium that you'll find as a supplement, and it is important to go over these differences. There is calcium citrate and calcium carbonate, often referred to by the brand name Caltrate. These are two forms of calcium supplements used for treating or preventing calcium deficiencies. The calcium citrate contains calcium combined with citric acid, and it is more easily absorbed by the body, especially for individuals with low levels of stomach acid, aka bariatric patients, or people taking acid-reducing medications, aka bariatric patients. It could be taken on an empty stomach, and it is generally considered gentler on the stomach and may cause fewer gastrointestinal side effects compared to calcium carbonate. And calcium citrate is the form, that is the recommended form for people who have had bariatric surgery, as it is better absorbed in the absence of stomach acid. Now let's talk about calcium carbonate, or caltrate. Has several differences that I will mention to you so you can know the difference versus citrate that we mentioned already. Calcium caltrate is a more concentrated form of calcium, providing more elemental calcium per dose, but it does require stomach acid for the proper absorption with meals. It is often less expensive than the other one, than the calcium citrate, and it causes usually more side effects, more gastrointestinal side effects, such as constipation, gas, bloating in some individuals. It is commonly found in over-the-counter antacids like, you may know, Tums or Rolaids, and it is known for these properties, for the anti-acid properties, in addition to being a good calcium supplement. So now you know you need calcium citrate, and now you know the reason why. What about iron? Iron deficiency is common after gastric sleeve, so a supplement may be needed to maintain healthy red blood cells and prevent anemia. Now, let's talk about vitamin B. Vitamin B complex. When we say complex, it means more than one. And indeed, a vitamin B complex includes several vitamins that play various roles in cellular metabolism and are important for energy production, nervous system, the maintenance of healthy skin, hair, and muscle tone. The B complex group includes the following vitamins: thiamine, vitamin B1, riboflavin, vitamin B2, niacin, vitamin B3, pantothenic acid, vitamin B5, beta-arbutin, which is vitamin B6, biotin. I know you probably didn't know it was a vitamin B. Biotin is vitamin B7, folic acid, it is vitamin B9, cobalamin, which is vitamin B12. Each of these vitamins has a specific function in the body, and they are often working together to support various processes. For example, B vitamins are involved in the metabolism of carbohydrates, fats, and proteins, and they help in the conversion of food into energy. They are also crucial for the synthesis of DNA and the maintenance of myelin sheath, which is the sheath that surrounds the nerve fibers. B complex supplements typically contain these vitamins at varying dosages, and they are often used to prevent or treat deficiencies that can lead to health issues such as anemia or skin disorders or neurological problems as well. I know we've talked about supplementing protein before, and we have videos dedicated specifically to this topic. Still, it is important to mention that high-quality protein supplements can help meet the increased requirements or the protein requirements after surgery, which are essential for healing and maintaining muscle mass. And finally, let us talk about omega-3 fatty acids. These can be beneficial for your heart health and may be recommended specifically if your dietary intake is insufficient. In general, it is important to know that the form of the supplement, make it chewable, liquid, or tablet, may also be important toward the absorption, and it can be affected in a reduced stomach size. Additionally, the dosage, the frequency of the supplements can vary, and it is essential to follow the guidance of your doctor or a registered dietitian who specializes in bariatric care. Well, there you have it. I hope you found this useful. And if you did, and only if you did, I would highly appreciate it if you can leave me one of these, since it helps us out to get this information to more people. Hey, and don't forget to hit that subscribe button. That way we can hang out again. I'm Dr. Álvarez with Endobariatric.com, where we are changing lives one sleeve at a time. Take care. God bless.